Promises to be fun, not just educational. So, welcome, welcome, welcome. I just exercise my voice. Welcome, welcome, welcome. Welcome, welcome. It's another time to meet with both old and new members of the community. Welcome. And if you are just coming across the channel for the first time, special welcome to you. Please come in, let me know where you are joining from, and if you can hear me, let me know in the chat. Kindly drop a message in the chat. Let me know if you can hear me. So this is a test for the global audience. This way we know if we're going to be having a blend of people from Europe and then those in Africa and other parts of the world. So let me know where you are watching from. I'm definitely aware that we are in different time zones. So I'd like to see which particular groups of people uh, fit into this period of streaming. So welcome, welcome, welcome. So where are you watching from? Are you watching from Nigeria, South Africa? Are you from Uganda, Kenya? I mean, talking about people who are early risers or who have been awake through the night. Or are you joining in from the United States? Which part of America are you in? Welcome to this live. Thank you for tuning in. Welcome, welcome. Please drop a comment in the chat. Let me know where you are joining from. Thank you for the like. First like. Thank you. Oh, two, three. Can we have more? Thank you, thank you, thank you. Thank you, everyone. Please confirm that you can hear me clearly. Islamic New Channel and Official 2 says hi. Welcome, Islamic New Channel and Official 2. It's good to have you here. Please, where are you watching from? Wow. Mr. Barry is here. Walking exercise for your health. Barry, walking exercise for your health. Good to have you here. Welcome, sir. And Ma, okay, if she's there, a special welcome to you. Um, Thank you, Islamic New Channel official, to saying hello, welcome, hi, and then Barry walking exercise for your health. Uh, Great channel there. Great people doing great things. Blessings, doctor. I'm here. Thumbs up, done. Bless. Amen. Thank you so much. Thank you for joining in. You know, I was saying earlier that I'm going to use this. It's been a while that I've gone on a live around this period. Okay, but this like a test for the kind of audience I will be having at this time. And the fact is that I'm sure that I've said it a number of times that um, around this time more people join in from Europe, um, from the US, and then other parts of the world in this time zones. I'm sure it's evening, night in your hand, in your location. Please confirm the time in your location. Thank you. Okay, Islamic News Channel official too says, "How are you? Doing great, and how are you too? Thank you. Thank you for the likes. If you are coming across the channel for the first time, I want to welcome you. We want to welcome you specially and say thank you for tuning in, not just scrolling past. You know, you that means a lot to me and to other members of the community. Okay, Barry walking exercise for your health says it's now 10:22 p.m. Yeah. That's interesting. All right, thank you so much for the feedback, Barry. And interestingly, that means there are people that are still awake late into the night. Others, depending on different individuals' schedule, people are at different things at this time. So, but if you are here, I'm glad to have you here and looking forward to more people joining in as we delve into this interesting topic for today. Interestingly, this live I think was scheduled for some hours earlier, but I really needed to catch some rest. Okay, I must let you know that it's about 3 a.m. in Nigeria, 3:23 a.m. right now, and you can imagine what that means for me on this side. All right, so let me see in the chat. Okay, Mr. Barry is watching from Orlando, Florida, USA. Yes, good to have you from Florida. I think in the recent time I've been having people. I think someone joined in the last time. Okay, no, Cams is also from Florida, I guess. Cams is also a content creator. Um, she does so much about health, lifestyle, really, and motivation for others. She's based in the US also in Florida, I guess. It's early morning for you, doctor. Yes, yes, it is. Mr. Barry, it is. I'm so so committed to this, being on this for about 4 years now, streaming, uploading videos, sharing short videos, long form videos, posting in the community, just providing information as a professional. Um, I'm aware that there are different platforms, different ways by which people access information. And when it comes to health related information, people tend to be confused sometimes. And one of the reasons why we have professionals is to help to deal with those confusions, those confusing areas, questions that people may have. I've come across patients, I've had interactions at different times, where you hear someone talk about some information they got somewhere, and as much as possible try to help them to see how that particular information relates to them. And some fears have been dealt with, some concerns have been uh, dealt with at different times with that kind of approach. Okay, some people find information, general information online, and then uh, just take it hook, line, and sinker. But when there's opportunity like this to interact with a professional, then we should take great advantage of it. All right. So even though this is like a general platform, of course, a public platform, there are occasions where we really, really benefit from having more personal interactions. So when was the last time you saw your doctor? When was the last time you had a medical checkup? When was the last time you decided to do something um, outside the routine when it comes to your life? So yes, it's early morning for me here, and so it's a lot of discipline, commitment to the community, not just members currently, and those who will be joining in, because as much as possible, this live session will be made available, okay, for people that will be joining in the future. All right. So we're talking about something very important, something common. Sometimes people try to confuse it. People understand, some people misunderstand it. People have questions around it. It's as common as water, maybe. Okay. And it's something that affects people globally. It doesn't matter your location. There's someone around you who is dealing with hypertension. It doesn't matter your class, your group, your race. There's someone somewhere close to you that is being managed for hypertension. All right. Looking at the extreme in terms of complications that arise from not understanding, not getting diagnosis early enough, and the fact that complications may then arise for certain people uh, more often than usual. These complications may leave individuals with long term effects affecting their quality of life. Okay, welcome once again. If you went out and you're back, okay, and if you're just joining in for the first time, welcome, welcome, welcome. Say special welcome to you. Let me know in the chat where you are watching from. Where are you watching from? Kindly drop in the chat, okay? We'd like to meet with you. And remember to double tap on your screen to like the live. Remember to double tap on your screen to like the live. Okay, let me know in the chat if you can still hear me. I hope I'm audible. Mr. Barry, hope you can still hear me. Okay, thank you, thank you. So I have some feedback. That's the fourth like. Thank you. I really like to know who is here, who is liking, and then who is listening, who is watching. Okay, it really helps the flow, sometimes. Though I have some interesting questions, I decided to ask ChatGPT, the common questions people are asking. What are common questions people are asking about hypertension? So let me know if you can still hear me. Am I audible? Can you still hear me? Remember to double tap on your screen as you come in, and you double tap, it gives this video session, live session, a thumbs up, and it increases the chances of being found by others. Okay. Let's support. I really appreciate your support on this channel. So what do you know about hypertension? Can you drop in the chat? If you, of course, if you heard as an adult, you must have heard. And interestingly, sometimes you come across people, maybe some people from rural settings, you find out that someone somewhere doesn't actually know what hypertension is. I mean, they probably haven't heard about it. or they didn't understand. So what do you know? Um, can drop in the chat. What do you know about hypertension? Um, and what question, if you have any question relating to this, you can kindly drop in the chat. So we're still welcoming people. Let me know where you're watching from. So glad to have you here. So, what are those areas of concern for you when it comes to um, dealing with hypertension? Please confirm that you can still hear me. Am I audible? Am I audible? Please confirm that you can still hear me. Please confirm that you can still hear me. Thank you. So I'm sure that we will be having early risers joining soon. People in other time zones around Nigeria. So if you can hear me, I would like to know. All right, welcome once again. If you are just joining in, remember to double tap on your screen to like the live. This is an interesting discussion we are having at this time. Um, Even though I know uh, more people could be joining in um, if this was started earlier, and then even um, as we move on, more people are going to be joining in. So let me know if you have a question relating to this topic. This is a very important topic, and the fact that it's actually called the silent killer. It's silent but loud, loud in the sense that when it presents with complications, they are usually sometimes fatal, other times limit the quality or reduces the quality of life of an individual. So, what do you know about hypertension? Okay, so I'm going to talk about those commonly asked questions. You know, when I decided to ask ChatGPT, I'm sure you know ChatGPT. All right, so these are important areas for people. People all over the world are actually asking, and you may be here and you may have questions relating to this. So, what is hypertension? Okay, hypertension simply means elevated blood pressure. Blood pressure that is consistently high. I mean, that definition is just simple. So, what's normal blood pressure? Normal blood pressure is less than 120 and less than 80. Okay, usually it should be between 90 to 120 for systolic, and then between 60 to 90 for diastolic. That's the lower reading when it comes to blood pressure. So your heart pumps blood. When it pumps the blood in your system, it pumps it to different parts of your body, And if for one reason or the other, this force is so much, and the pressure that goes through the channels, talking especially about the blood vessels um, that carry the blood in your system, that force becomes higher than 140 over 90. In fact, right now we are talking about 130 over 80 being defined as hypertension. So the American Heart Association has come up with new values that once an individual is having above 120 over 80, then that individual needs to have close attention paid to them, close attention, to that blood pressure. So have you had a measurement that is above 120 over 80? Are you even talking about 140 over 90, 150 over 100? These are actually values that depict elevated blood pressure, high blood pressure, or hypertension. All right, so it is that pressure that the blood, force of blood exerts on the blood vessels. So when this force is too high than normal, it's higher than normal, then we're talking about high blood pressure. So I have described this at times like water passing through a hose or pipe. Imagine the force increasing so much that the hose or the pipe can no longer support the flow of water. And you know what can happen? That force can be strong enough to cause a crack to the hose or to the pipe, and even cause the pipe or hose to burst and then leads to leakage. So that's what it is like when it comes to talking about high blood pressure. So, what are the normal values? What's normal value for blood pressure? I've said it that it should be below 120 over 80. While if we talk about being elevated, it means you're having above 120 to say between 120 to 129. Then your diastolic being lower than 80. But for different medical categories, differentiating these different categories, there's something called stage 1 hypertension, and that's where you have 130 to 139 for diastolic, and then for the systolic, 80 to 89. That's stage 1, 130 to 139 over 80 to 89 for diastolic. While for stage 2 is 140 and above, and then 90 and above. But in a situation where an individual is having 180, 190, I mean, you're talking about a point of crisis. And there's something called hypertensive emergency, and there's something called hypertensive urgency. We may not go into details of that for the sake of the public, because it's not a, a lecture, so to say, as a professional lecture. Okay, but it's in general information. So when, for whatever reason, an individual has a measurement of 180 systolic over 100 or 120, then that's a crisis, a matter of crisis. And then importantly, the individual must be seen by a doctor for intervention, or a health professional that has a good knowledge of management of hypertension. So, what causes high blood pressure? Quietly, many causes, quite a number of causes. We actually described initially as idiopathic, no known cause, but factors that have been identified include genetic factors. So that means if an individual has a high blood pressure or being diagnosed of hypertension, there's a tendency that down the line there may be someone in that generation or subsequent generations that may have a similar experience of hypertension. So because it's inborn, it's genetic, something already there, and it's being passed from one generation to another. So if you are here with me and you are joining in for the first time, please double tap on your screen, welcome, and let's know where you are watching from. And then if you were here earlier, but you're not able to drop a comment in the chat, kindly drop a comment. Let me know if you can hear me clearly and then where you are watching from. If you have any question, kindly drop in the chat. So, what are the other factors? Majorly lifestyle factors, including sedentary lifestyle, being overweight or obese, comorbidities like diabetes, high cholesterol levels. This puts an individual at risk of developing hypertension. In fact, this description is what is given to hypertension and diabetes, twins. They are like twins. I mean, if an individual has a diagnosis of diabetes, there's every tendency that that individual may also develop hypertension. Okay. And also high cholesterol levels. So, talking about the triplets, we talk about metabolic syndrome. An individual may suffer from diabetes, hypertension, high cholesterol levels. Such an individual may be overweight or obese. These are uh, friends. They are usually like working together. Okay. So if you are being monitored for one, then you should be monitored for other uh, related conditions. That means if you have a diagnosis of hypertension, part of your screening should include screening for cholesterol levels, your screening for diabetes, your blood sugar levels should be checked regularly, and of course, good monitoring of your weight, monitoring very important. Okay, thank you for the 50 like. I really appreciate it. Thank you for the feedback. This makes it so interesting. Wow. Wow. Who do we have here? I mean, I knew that we'd be having some some peculiar audience today at this time. It's been a while. I've gone live around this period, and I'm so sorry. Missing out on some of our loyal community members. I mean, Toya is here. Toya, welcome, Toya. Toya Cross Farm, saying hi, Doc, and saying hello, chat. Welcome, Toya. It's good to have you here. How have you been? How have you been? You can see Toya in the blue label. She's been uh, a foundational member, so and interestingly, I can't forget the fact that Toya was the first to drop a a, a super on this channel when I got monetized. I mean, I can't forget that. So thank you so much for your support. And how is your husband? How is the family? It's good to have you here, Toya. Thank you. It's good to be here. Hey, doing great. I mean, I don't know. Sometimes we miss out. We miss on contents, upload videos, posts. I'm still studying around this, and I've told people that it's important to not just subscribe, but tap on that subscribe button and look for all notifications and enable all notifications on your channel for any channel that you are subscribed to and you want to be receiving notifications of videos and of course notifications of live sessions like this, and then community posts. You're able to find them easily when you are uh, subscribed and then when you have all notifications enabled. So if you are here today and you are yet to subscribe, kindly subscribe and then look for the all notifications. among the list available. You can just click on that and you will be notified regularly. So I'm going to give Barry walking exercise um, moderator status, moderator standard. So Toya, I'm not sure if you have met Barry walking exercise before. That's uh, a lot being done by a wonderful couple. I mean, elderly couple there, encouraging others to keep moving, to exercise, and great benefits there for them and everyone who participates in. So I join their live sometimes and just do my part in contributing and learning. Okay, so family is good. Thank you, Toya Cross Farm. It's good to know. Yes, that's important. So you don't miss out on anything. Yes, yes, very important. Toya is saying hello to Barry. Saying hi, Barry. Toya, where are you watching from currently? Where are you watching from? We are talking about something very important at this time. Of course, there's no health related matter that isn't important. Okay, but this particular one is something that is common, but sometimes little understanding of this for some people, and millions of people are dealing with this. Um, Many don't even know that they have hypertension. People that know diagnosed are like close to half, not or even up to half people are able to get diagnosed. And for those who have been diagnosed, I mean, maybe a quarter are currently on treatment. And so most people that we get to see sometimes come in with complications of hypertension. I will be looking at those. So we're talking about the common questions that people ask. So if you have a question around this, Toya, kindly drop in the chat. Okay. Yes, Toya is saying yes. I know Barry. Okay, okay, that's great. He and Liz are great motivators in the exercise and LD living. Yes, yes, doing a lot. I mean, I'm so inspired by what they do, encouraging others. Of course, keeping fit as individuals, as a couple, encouraging each other, and then encouraging their community. And that's the way to go, right? So yeah, that's interesting. It's good to know that you are aware. Toya is in Canada currently, and it's good to know that you are doing so great. Yes, I can see your comments, Toya. You say lifestyle change is important to manage hypertension. That's so true. Lifestyle. So I usually say this way that even if you have a diagnosis of hypertension, for anyone that has a diagnosis of hypertension and you are probably on medications, antihypertensives, then that shouldn't stop your lifestyle changes. It shouldn't, it doesn't mean that you can continue or you should continue in uh, poor lifestyle. I mean, those diets, those that life of inactivity, um, what are those other risk factors? Alcohol intake, smoking, those aspects need to be looked at and correct changes should be made to avoid um, worsening condition and even poor management from even if you are taking medications and you are still poor at this lifestyle, you will definitely not enjoy the benefits of those medications well enough. Okay, so you cannot be antagonizing the treatment you are having by your lifestyle. So very important, very important. Thank you, Toya. Toya says lifestyle change is important to manage hypertension. And then what are your tips as it relates to your diet in managing hypertension? Very good. Very good. Thank you for that question. Okay, so I'll quickly talk about um, other common questions, talking about the foundation, then we'll move into tips for diet in managing hypertension. So I will pin that. So as a reminder, so let's keep the questions coming. So other lifestyle. So yeah, before you came in, or at the point you came in, we were talking about causes of high blood pressure. Mentioned genetics, mentioned lifestyle, and that's the point we were on when you came in. And then these are the culprits. We talk about too much salt, sodium laden meals, puts an individual at risk of hypertension. Talk about alcohol intake, smoking. Smoking damages your blood vessels and make them fragile and easy to lose their strength to actually carry blood to different parts of your body. So imagine, like I said, something damaging that hose or pipe that carries water. Apart from leaking, it can actually cause a lot of damage to the environment. So looking at the environment of the brain, the environment of the kidney, the heart, if there's for any reason, if there's a leakage of blood into those areas, you can imagine what could happen to the individual. So there's something also called secondary hypertension, and that is related to conditions that may uh, predispose an individual to developing hypertension, like kidney disease, polycystic kidney disease, for example, can cause an individual to have uh, high blood pressure. Other things include thyroid disorders, certain medications may also be responsible. So, what are the symptoms and complications that can arise from hypertension? So, I'll mention some symptoms. Toya, just give me some time. We will definitely talk about. I've pinned your question. Then I can see in the chat hypertension and diabetes runs in my family, so I am cautious. Wow. So that's very important to know your family history, because genetics is first. If it's in a generation, there's a tendency for it to appear in subsequent generations. Okay, but if you're not going to have that happen, some changes need to take place. Must just be that, change of lifestyle. Can't continue in the same pattern and expect a different result. Okay, so whether you talk about making changes to your diet, being more active, and these are areas that we'll be looking at as we move on in this discussion. So, what are the symptoms? In fact, usually there is no symptom, like you have heard many times. It's a silent killer. Usually, hypertension doesn't have symptoms. But when symptoms begin to appear, it may mean that the levels of the blood pressure are quite high, and in fact, some complications may be setting in already. Interestingly, Toya, we talk about this that hypertension and diabetes are like twins. So they want to always, usually, move together. That's why if an individual has a diagnosis of one, they sure need to be monitored for the other. So it shouldn't be a strange thing for you if you are being managed for hypertension and then you are being asked to do some screenings to check your blood sugar levels, to check your cholesterol levels, your kidney function. These are important areas when it comes to managing hypertension. So, what are the symptoms? So, when symptoms begin to appear, usually people talk about having a headache. Of course, headache is a symptom that can be caused by many things. Okay, so when an individual has a family history of hypertension and they have other risk factors and they complain of a headache, of course, blood pressure check is very important. Okay, so headache could be throbbing. It may just come like something that comes in a particular way, in a particular period of, of the day. So you need to note this. Are you having frequent headaches? Some people even complain about hearing their heartbeat. You know, that is abnormal. Normally, you shouldn't be hearing your heartbeat. That's talking about palpitations. Okay. Some people complain of chest pain, and that chest pain sometimes may even radiate to the arm and the back. Okay. Some people complain of fatigue, easy fatigability. It's one other symptom. Some people already begin to manifest with some complications and begin to have uh, puffiness of their face, swellings in their feet. Those are uh, already signs of complications. And for some people, they begin to have reduction in their blood flow. Some people begin to have tingling sensation in their limbs. So that's those are some of the symptoms about when it comes to hypertension. Yes, I realize. Okay, let me read your comment. Yes, I realize that diabetes and hypertension tends to go together, right? And then frequent urination. Yes, yes. At that point, possibly the kidneys are beginning to lose their function, setting in chronic renal failure, or may even be related to diabetes now. So, if you're having these symptoms, there are enough reasons for you to present to your doctor for proper evaluation. Very important. So, it's not something that you treat over the counter and then or you overlook or neglect it. It can lead to some fatal consequences, and we don't want that to happen. Okay, so thank you, Toya. Now, let me look at my notes here. Okay, so another question that people ask is this: can you have high BP without symptoms? Of course, I've mentioned that someone may have high blood pressure. Routinely, the blood pressure is checked when people come to consulting rooms. The nurses usually will check, and of course, maybe checked more than once. And um, someone may be coming in with something that is not even related to blood pressure. It's a complaint that's not related to blood pressure. It may be a case of infertility, and by the time you check the individual's uh, blood pressure, you just find out that, oh, this blood pressure is quite high. So people can have high blood pressure without symptoms. So what can happen if an individual is untreated? Now, this can lead to a heart attack, can lead to a brain attack, talking about stroke. Uh, Individual may also suffer from kidney failure, loss of vision. Talk about peripheral neuropathies, um, losing feelings, nerve damage. Those are some of the complications that can arise from untreated hypertension. So, does it cause headaches, dizziness, or blood vision? Yes, sometimes when the blood pressure is very high, um, symptoms like that can occur. individual may feel dizzy and have a blurring of vision. And at that time, intervention is very important. So, how does hypertension affect the organs? Yes, this is another commonly asked question. The way it is that hypertension, the blood force of blood passing through the vessels actually affect the vessels. It wears the vessels out. Vessels may begin to thicken and leak and burst, as I mentioned earlier, and this can affect the organ that they supply, or even organs outside their supply. Now, let's look at diagnosis and monitoring of blood pressure. Let me know if you can still hear me, and if you have any question relating to this, please let me know in the chat. Now, how is high blood pressure diagnosed? By measuring your blood pressure, at least one or two um, readings, preferably two readings on separate days, not just once. So, preferable that even when you go to your doctor, your blood pressure should be checked twice, maybe a minute or 5 minutes interval for the checks, and then you will have an average taken to determine your blood pressure. Of course, we'll still talk about why some people have high blood pressure when they are in the hospital and they have their blood pressure normal outside the hospital. Okay. So it's important to note that a one time reading may not be enough to diagnose high blood pressure or hypertension. Okay. So there can be a momentary experience of elevation of blood pressure, but a diagnosis of hypertension can be made, preferably even using 24 hours ambulatory blood pressure monitor. you know, that's attached, and that helps to give the accurate measurements, considering the different activities that individuals go through in the day, in the course of the day. Okay, so because the readings actually change with changes in the time, changes with activities, with diet, exercise. Different factors affect the the readings that you get every time that you check your blood pressure. So, and I did a session some time ago where I talked about the importance of checking early in the morning and checking in the evening, preferably maybe after 30 minutes of waking, or before bed, just before bed. So that will help to also give the readings that are normal for you as an individual. So, but when you check randomly, that will not give you the readings that are normal for you. So how is high blood pressure diagnosed? Measuring, I've mentioned that. How often should I check my blood pressure? How often should I check my blood pressure? Okay, thank you, Toya, for the feedback. Yes, you can hear. Thank you so much. How often should I check? The adults. Okay, the recommendation is at least once a year. But right now, we talk about checking at least twice a year if you have checked at different times and you do not have a risk of hypertension. Okay, but if you are at risk, being overweight, you have a family history, you have a diagnosis of, you have been managed for diabetes or uh, dyslipidemia, that's high cholesterol levels, you should be checking at least every 3 months. Okay, apart from this general information, your doctor may recommend for you something different that's related to checking maybe weekly, or checking and for certain periods of consistently, maybe every day or even checking in the morning and checking in the evening, and having a proper record to present to your doctor. So that's very important. I will talk about using the home blood pressure recordings in your management. Very important. So if you're hypertensive, if you have been diagnosed of hypertension, then what is recommended is that you check daily or weekly at home. So I believe you got that. Then next question is, can blood pressure vary during the day? Yes. Can blood pressure vary during the day? Yes. It's usually lower in the morning. So when you wake, check in, very good. And but with activities, as I mentioned earlier, there will be variations in your blood pressure, and it rises during the day. So that's why sometimes if you check uh, during the day, you find out that you have higher values compared to early morning readings. So, with activity, with stress, your blood pressure may increase. Now, let's talk about what happens when blood pressure is checked in the hospital and it's high, usually for an individual that has normal readings at home. Okay, so that's called white coat hypertension. White coat hypertension. That is related to the fact that for one reason or the other, that fear or anxiety that comes around high blood pressure or hypertension makes an individual to have their blood pressure elevated. So it's a bit of described as a false elevation, okay, because normally when the individual is in his or her normal environment, they have normal values. So that is more reliable, normal values within your home environment. Okay, but there's also something called max hypertension, where in the hospital, the individual has normal blood pressure readings, but when it comes to checking at home, it's usually high. So that's actually another side to the blood pressure measurements. So I'll talk generally about what you can do to lower your blood pressure naturally. Let me know in the chat if you can still hear me. Let me share this with the community. All right, so we're moving to the final parts of the commonly asked questions on hypertension. Welcome back. So, how can I lower this high blood pressure naturally? That's one common question. Importantly, we've talked about the need for lifestyle changes, right? The need for lifestyle changes, and this include the need to reduce salt intake, sodium salt specifically, and the need to increase potassium sources. Very important. Um, Eating fruits and vegetables, and I'm sure this is already answering some of the questions or the question on what are your tips as it relates to your diet in managing hypertension. Okay, that question was asked by Toya. And exercising is another one. 30 minutes of exercise per day. It's important. Talking about brisk walking, cycling, skipping. These are important forms of exercise. And if you can swim, swimming is also good. Maintaining healthy weights. That's another way to lower your blood pressure. This has also been found to significantly reduce the measurements, even in millimeters of mercury, that you will even notice it as you do 1 kg, 5 kg reduction of weight. You will notice drops in the readings. Your readings. So sleep is another one. Sleep at least 6 to 8 hours of night rest is very important. And learning to manage stress is another way to reduce high blood pressure. We have four more questions, and question 16 will also address the question on tips when it comes to dietary management of hypertension. So, which foods should I avoid or eat more of? So, let's talk about the foods to avoid. This includes avoiding salty foods, generally talking about snacks, processed foods, fries, sugary drinks, excess red meat. These are things to avoid. While the things that you should be eating more, all right, leafy greens, though they may not be tasty, so to say, sweet in the sense of sugar, but bananas, beans, whole grains, fish, low fat dairy, these are important to be included in your diet. Okay, if you are in Nigeria, of course, ugu, beans, or fada rice. Of course, you can also get this in your area if you have access to Nigerian food types. In the US, spinach, oatmeal, salmon. So whether you are in Los Angeles, you are watching from Lagos, the important thing is to ensure that you find food sources that will help to uh, lower your blood pressure if you are experiencing high blood pressure. And this is actually recommended dietary lifestyle for each and everyone for a healthy life. So, what lifestyle changes are going to help? What are the helpful lifestyle changes? One is to quit smoking if you do. Next is to reduce alcohol, stop alcohol completely, get active, eat balanced meals, check your blood pressure regularly, and then keep your appointments with your doctor. Um, that's those are parts, very important aspects of management. So, do I have to take medication forever? So, note this. Uh, even though we say, oh, these medications are for life, but not always. If caught early and you make consistent lifestyle changes, your doctor may lower or even stop your medications. There have been instances that has happened. So, but never stop drugs on your own for no reason. You say, or except you have some kind of drug reaction and you suspect that is related to the antihypertensive that you are taking. So if you are being placed on medications, always consult with your doctor for a review if you have any challenge with using those medications. So, what are the side effects of blood pressure medications? Possible side effects include uh, dizziness, and these are common to most antihypertensives, fatigue. Some may even cause cough. Specifically, there are some specific medications that will give some specific side effects, like cough. So, for this, your doctor may definitely help you to review and change your medications. Swellings in the ankle, swelling in the elbow, different parts, swelling may be another uh, side effect from taking antihypertensives. So, but not everyone actually gets to experience these side effects. So, but always discuss with your doctor if you notice any side effects, unpleasant experience for a review of your medications. Finally, let's look at prevention. So, what can be done to prevent hypertension? Even though we say hypertension cannot be cured, but it can be controlled or reversed to normal levels. That is where there is early detection. So, checking your blood pressure regularly is important, making lifestyle changes, and then for those who have a diagnosis to ensure or take proper treatment. So the earlier you actually start, the better the outcome. I want to say thank you for watching. Thank you for listening. Thank you for participating. It's been an interesting session. So, these are commonly asked questions, but if you still have any question watching this replay of this session, you can always drop your question in the chat, in the comments. Remember, high blood pressure is silent, but it's not something that should stop you. You can deal with it, you can manage it, you can reverse it, and then if you have learn something from this, and of course this to motivate, to encourage you. If you have never been diagnosed with hypertension, then it's a good thing, and you should try to maintain or improve on your lifestyle, and then keep monitoring. If you have a diagnosis of hypertension or any other medical condition, it's not the end of the world. It's always good to know and to be encouraged to do proper monitoring, and then do your lifestyle changes, follow up well with your doctor. I'm sure you will experience some interesting improvements yourself. So thank you for watching. Thank you for tuning in. Okay. Toya says, thanks for sharing, doctor. Thank you. You are welcome, Toya. And then you say, very informative. Yes, thank you. Thank you. Thank you for the feedback. Thank you so much for the feedback. So, Toya, how often do you check your blood pressure? Now, looking at, you mentioned that there's a family history of hypertension, diabetes. So, how often do you, as an individual, check your blood pressure? Okay, that's great. That's good. You say at least twice a week. That's good. That's good. That's good. Yes. Yes, I like that. You say you have a machine at home. Very good. Very good. Very good. Now I've been talking. Let me see if I can pick my machine readily and see what my blood pressure will read at this time after talking for at least 1 hour. Let's see. Do you want me to try that? Let's see. Let's let's see what my blood pressure will rate. Okay. So I believe you've been getting normal values. Okay. So just keep at it, and that's the way to go. Good monitoring. You know, some of the people that we get to see at the emergencies are people who probably have not been checking, little or no checks on their health or even their blood pressure, blood sugar. Some are people who decided to stop taking their medications for one reason or the other, and then they develop a complication, a stroke, or even some people suffering from a heart attack. Okay. Yes. So yeah, that's a good one. So you say I could do a demonstration of how to use the machine properly. Yes, yes, I should do that. All right. So should I do that on a live, or I should do that in a video to upload as a long form video? What do you suggest? Okay. I know that that's going to help a lot of people. I mean, showing how to use the blood pressure machine. So I mean, yes, a video will be fine. Thank you. That will require, you know, setting it up properly and helping people, maybe having a subject, or you know, um, someone that can volunteer to be used to demonstrate that. All right. Okay. I'm getting your suggestions, Toya. So let me screenshot this. And that's one thing about having your people come around during your live stream. You keep getting suggestions. You know, those are very, very important support tips that I'm getting here. Thank you to Toya for this information. You know, give tips as to what a good reading is, yes, and then difference between low and high blood pressure, yes, diet and lifestyle tips to prevent and manage it. Yes, we should be exploring these areas more. So yeah, if you have observed, looking at the most viewed videos on the channel, apart from the one on libido, the next on the list with most views is that one I did on blood pressure, management of blood pressure. And so maybe we should have some more videos around that. Even though I have observed that when it comes to talking about the algorithm, what people are searching for, you know, these are uh, subjects that what do you call them? There's a term that we use to describe this kind of content. You know, they are always in the search. Okay, but there are times that I just feel that the algorithm could have changed, but the important thing is to help people to get information relating to what they are asking for per time, and then as much as possible feed the community with this information. All right, so I try to do that niching thing, you know, but as a family physician, sometimes you just want to explore. So we do our mental health, reproductive health, management of chronic medical uh, conditions. Okay, these are important areas. All right, so diet and lifestyle tips to prevent and manage it. Noted. The algorithm does change. Yes, yeah, it does. It does. So to me, it has to be a balance between serving the algorithm. It's actually about the audience. You know, some of the people that thousands of people that showed interest in the video on libido may now be considering other areas, searching other areas for information. Okay, so but there are still people definitely that will uh, keep searching in that area because it's like a pain point for them in the long term. So as a physician, I think you have a unique niche to offer. Yes, yes, yes. Yes, thank you, Toya. And libido was a good one. Yes. I found it interesting that, people kept watching. I even have direct feedback, people who gave me direct feedback on um, that video. And I think I've done some videos around related videos. Okay. So, but I hope YouTube will do more, in promoting those videos, considering the feedback and how helpful those information have been to people. Yeah, so the video on libido, the video on hypertension, video on cholesterol, those are the top three videos. I've tried to do some things different around, and I've seen those ones coming up too. So I'll keep trying to explore these areas for people to get more information relating to hypertension, reproductive or sexual health, mental health, cholesterol management, diabetes, you know, and definitely there is a need to put that in individual and community family touch to it, and that's what I do by trying to make it a bit relatable and explaining as much as possible in a manner that people can relate to it, right? Perimenopause and menopause is a good topic, I think, as well. Yes, I have short videos on menstrual health and a menstrual cycle, and I saw that that was also doing well. So I should take note of that. Interestingly, I have my notes on some of these topics. So just about retuning this to fit into this time. Okay. I really appreciate your feedback, Toya. And then somebody did a seventh like. Thank you for the like. Thank you for joining in. Uh, I'll be glad to know where you are watching from. As we move towards 5 a.m. now, most on this side, most students, I don't know how is it in Canada now, most students will be resuming. And I'm sure a lot of parents, guardians are getting set for work today. Okay, so but for early risers, I'm sure they will be joining in. Anxiety and stress, how to manage and deal with it could be another topic. Hmm. Yes, I'm noting this so that I can follow up and follow through on them. Infertility and PCOS. Hmm. Yes, infertility and PCOS. Yes, these are very important topics, areas to be considered, and I mean we need to delve more into this. Thank you so much. Canadian Queen is here. Canadian Queen, welcome. Thank you for joining in. Good morning, sir. Thank you. Good morning from here. Canadian Queen, are you in Canada right now? Are you actually in Canada? Are you in Canada, like Toya? Are you in the same area? What part of Canada are you in? Now, it's been a long while. I've seen you on my live, or I've even seen your channel notification. I need to check and be sure that uh, I'm still subscribed. I have all my notifications on for your channel. Very important. We talked about this earlier before you came in, that it's important to not just subscribe, but to check that all notifications are turned on for the channel that you are subscribed to. Okay, so I need to check my settings for your channel, for example. Okay, so thank you for joining in. How are you doing? How is Canada? If you are in Canada, really. And then, how is content creation going? We've been talking about an important topic, something that affects people globally. Millions of people are dealing with this. Not even up to half have been diagnosed, even though it's described as a silent killer. And even in situations where it has not led to death, it has led to some debilitating complications affecting the quality of life of individuals. And that's talking about hypertension. So, Canadian Queen, if you notice, Toya is here. Toya has been engaging. We've addressed some questions, common questions on hypertension. And Barry was here also. I don't know if he's still here. So Barry was here. You could do, okay, Toya, let me read your message. You could do a video on the topics and then a live with question and answer on the topic. That's interestingly what you have just mentioned, asked, what you have suggested is something that I saw, checking chat GPT was saying that you should do things around this, uh, uploading long forms and then doing a live session, question and answer relating to those particular topics. So that's interesting. That's interesting. Thank you, Toya. Doing a video on the topics and then a live with question and answer. So that will help to actually drive home the points, and that way there will be a bit of more focus of on when it comes to niching down. Right. All right. So as a family physician, sometimes it's really challenging trying to niche and then focus. Of course, these areas are common areas of interest: mental health, reproductive health, um, chronic or non-communicable diseases. Um, what else? Basically, I mean, those three areas very important. So, Canadian Queen, do you have any question, any comment, any observation? Do you know your family history when it comes to your health? We mentioned that genetics is one major factor when it comes to hypertension or some other uh, chronic medical conditions. Genetics is a risk factor. There are there's a classification such that we say there are non-modifiable factors and there are modifiable factors. So genetics, age, race, these are non-modifiable factors for hypertension and other medical conditions that are non-communicable. Okay, while for the modifiable factors, these are factors that are related to lifestyle. Talking about being sedentary or being active, smoking or drinking alcohol. These are factors that can be influenced, they can be changed. So if an individual who smokes or who has been smoking or drinking alcohol decides to stop today, so that way we begin to arrest the progression in terms of the effects of smoking or alcohol intake on that individual's health. So those are modifiable factors. Factor when it comes to inactivity, you can increase your activity levels. You can do brisk walking. You can swim if you can, and then uh, cycling. These are things that you can do, things that you can change. Okay, you can change your pattern of diet. I need to mention, Toya, if you are still here, what are tips uh, for managing hypertension as it relates to diet? Now, I need to emphasize the need to um, have a healthy plate, healthy meals regularly, and that should include having vegetables and fruits in your diet, having the protein, and the 25% of carbohydrates. Okay, then healthy fats, very important. So these are uh, things that we must consciously be doing, should be doing to experience the the kind of life or health that we desire. So we must be moving from just desiring health to uh, doing things, taking steps, putting action to what we want to experience. All right. So people talk about wanting to uh, have a good lifestyle, good weight, uh, feeling good, mood, and all those. But what are you practically doing to ensure that you experience it's like that you experience that kind of life? So if you are going to be experiencing that, you must be committed, you must be disciplined, you need to learn, you need to uh, seek information, and that information that you seek should be definitely professional as much as possible, and then relatable, relating to your own peculiar needs. And of course, general information is important, and then applying the principles that guide living in good health. I hope you got um, those points. Let me know if you're still there and what are your thoughts on this. So, what are the other areas? Toya has actually listed different areas that we should be talking about. Mm. So, is that grace to sit in front of the camera now and then shoot and then upload? That's what I need more now, right? So, just give keep giving your support in your prayers, in your engaging, with the videos. Drop a comment, ask a question, like, share, Those are things that will help to uh, keep growing the channel. And I mean, there's no limit to what we can do together as a community. You know, looking forward to greater heights, greater things with you, each and every one of you. I really appreciate you. Very soon we'll be talking about early risers, maybe in Nigeria and other um, surrounding countries. Victoria, if you're still there, so what are the areas? Sometimes we get more uh, positive feedback, but I'm sometimes also concerned. What are the things that you have observed that, um, okay, we can talk about the things that are good that are being done, but what are the things that you think can be improved on when it comes to my videos? Is it the lighting? Is it the audio? Is it the delivery? What are those things that you have observed that you think can be improved on? Sometimes there's usually that difference. Usually there is difference in approach when it comes to the type of content that we are making. People do vlogs, people do, entertainment, different niches, and everyone has their own approach, personality, and all that may influence um, the way things go around their content. So, as much as possible, I am willing to actually improve and make this as much as possible interesting, entertaining, not just educational. Of course, the foundation is being educational. How to supply people with information and in a relatable, explanatory manner. All right. Like I will normally do with my patients in the consulting room, helping them to navigate areas around their health. So maybe the delivery, so you can captive person to watch the end. Okay, thank you for the feedback. Um, so talking about making a hook, that's what they call it, Abby. Hook. Now you hook your audience from the beginning, and then being consistent to ensure that they keep watching till the end. That's something that is important. Okay, so that will involve putting in some live. Sometimes uh, some of us we just talking, slowly and all, just taking it, bringing it bit by bit. Okay, but sometimes they say, oh, you don't have to talk so fast. If you talk so fast, you may miss out on your information. So there has to be a balance, whereby captivating the audience and then helping them to get value along in the course of watching the video. So maybe the video, so you can captivate person to watch the end. So for some persons, there has to be something in video to grab their undivided attention. That's very important. So what are those things? For example, in a health, looking at those topics that you have suggested, what are the things that can possibly make you to keep watching, or any other person that may be interested in a health related channel or content? What are the things? Okay, thumbnails and titles can help. Yes. So I'm trying to improve more on thumbnail, and then twisting titles to capture the attention of my audience. So thumbnails and titles very important. Thumbnails, titles, content. So are very important aspects of content creation. I will surely be making good use of your suggestions, and of course, it will reflect in the content delivery on the channel, and definitely we expect more growth from there. So Toya, what's your work pattern? What's your schedule currently? Are you are you free for days or weeks? Are you on leave, or you have a schedule? You are working a shift or something? How is your husband and the family? So my plan is to um, end this session soon, and then to prepare towards another session that will help those in this time zone, Nigeria and other um, countries in this time zone, to be able to connect and give them something that will definitely benefit each and everyone. So Toya says, I work a 7 hour shift daily. 7 hours. That's interesting. That's interesting. Okay, 8 hour shifts. Okay, okay. So is that like the 8 to 5 or 8 to 4 p.m. that we talk about? So you start working at 7 a.m. Oh, that's great. So yeah, what's your field? What area do you actually work in now? What's your special area of work interest? 7 to 3. Okay, 7 to 3. That's good. So what about weekends? Do you work weekends? Saturday, Sunday? Okay, business and finance. Business and finance. That's interesting. Business is it? Of course, our finances affect our health. and thank God for health insurance in some places doing well with health insurance. But when people pay out of pocket, whether it's insurance or paying out of pocket, it's really important to note that funding when it comes to health is important, whether individual funding or NGO or government funding. Okay. Tell you what, Monday to Friday, very stressful at times. Oh, stressful. Okay. I hope you are being paid well on the job. How long have you been working with them? So, that's life for you. You just have to engage and be doing something. But we must be taking care of ourselves as we go on doing things in life. So yes, health insurance is good. So you even use yours to get messages from time to time. Oh, okay. I need to get that clearly. So health insurance is good. Yes. You even use yours to get messages from time to time. How do you mean? What exactly do you mean by getting messages? Um, okay, massages. Okay, 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 okay. That's interesting. So that's interesting. Yes. Okay, so there are some packages that give that provision. That's interesting. Okay, I saw somewhere too. Okay, I saw somewhere, yes, in Nigeria too. Um, Certain health insurance HMOs that make provision for things like that, spa, massages. Wow, that's interesting. So, what do you mean by very stressful at times? Your work, very stressful. So, we must actually be balancing work life. We must find time to rest. We must find time to relax and not get overwhelmed with work. All right, and that's very important. That's very important. So, thank you so much, Toya, for engaging. You really made the live session interesting. So I wish you a very good day. Have a have a great time. Have a blessed week. Okay. Okay, Toya says I deal with a lot of figures and calculations. That's mental work, a lot of mental work there. Hmm. I believe you are being well paid for doing that. You are well paid. Because I believe, I mean, if one is giving, you must find ways to actually receive and receive well and be comfortable. Very important. You must know what you are working for. Toya? Yes, isn't that true? You are not a missionary. Are you a missionary there? No, you are not. So as long as the company is also generating income, you are generating for them, you are working, doing your own part to generate income for the company or the institution you work for, then they should also treat you well, right? The laborer is worthy of his wages, his or her wages. Okay, it's a fairly good company. Oh, that's fine. Yeah, it's good to know. How long have you been with them? So yeah, how long have you been working with the company? Okay, 3.5 years. Yeah, that's a long time. So how do you find time to create content? Like I said, I'm going to check my settings and be sure that I have my notifications for your channel, all notifications on, because I've not been getting notifications from your channel, and I'm not sure also from your husband's channel. Okay, I job up for better pay and benefits as I see the need. Yes, really, that's what's important. You know, I have to see how much more you can do to earn more. The player says I job up for better pay and benefits as I see the need. Hmm. Yeah, that's good. You're doing a lot as a woman. We relocated. I was going to ask about your husband. He said we relocated recently, so we are trying to settle in. Okay, from where to where now? I think I remember you shared something about that, about relocating. So from where to where? Okay, you say I've not been doing content recently. Okay, so maybe that's why I've not been seeing your videos or live not session notification. Okay, okay, still within Canada, just another province. Oh, so what's the motivation for the relocation? Why did you decide to move from one province to another? Wow, so that's interesting. So I know people do, or maybe for work reasons, work related, family, different reasons. Maybe settling down your own home, house in Canada. So is this new place better or more exciting than the former province? Wow. Learning something here. Some provinces are more expensive than others. Plus job changes for your husband. Okay, okay. That's interesting. Hmm. So understanding what works for the family is very important, and that's good. So congratulations. I'm sure your husband has a better job. Congratulations to him. Okay. And he said cheaper but slower, not so fast paced. Okay, not like the former province. So that's good. We must be ensuring that we are wise in our spendings and cost of living and all. So housing and taxes are more expensive in some provinces. That's interesting. So how is it in Ontario? How is it in Ontario? Okay, I like this. Toya says, I want to retire early. Hmm, that's a good, that's a good one. That's a good one. It's a good one. I mean, having a retirement plan, an early retirement at that, that's important, you know. But one thing I think is also important is this, that you begin to look at doing something for yourself. What do you think? I mean, having a personal business, private enterprise that you are also doing to give yourself a lifetime of financial rest and control. Yes, I can see you say Ontario is expensive as it relates to housing, but in terms of entertainment and lifestyle, it's the best province. That's interesting. Ontario. Hmm. Is that the capital? Mm. And it relates to housing, but in terms of entertainment and lifestyle, is the best. The bubbling city, right? Or province. Let me take some water. Yes, okay. Good to know that, yes, you are looking into your own small business. Yes, we need to start. You need to start somewhere and then building up, building up, building up. It will surely grow by God's grace. Taxes are high in Ontario as well. That's serious. Ottawa is the capital. Okay, yes, thank you. Ottawa is the capital. So how is Ottawa compared to Ontario? Which one bubbles more? And then talking about entertainment and lifestyle, how is it in Ottawa? And then the housing, is it better in Ottawa or is the same? Is it the same in terms of cost of living in Ottawa and in Ontario? Okay, Toronto is better in entertainment and lifestyle. Toronto. Okay, Ottawa is similar to Toronto. So what about the healthcare services? What about the healthcare services? Where is it better? Which of the provinces has um maybe the best healthcare services, and in terms of structure, in terms of availability of professionals, doctors, other health workers? there's a particular material or materials in medicine that we call Toronto notes. Uh-huh. Does that mean Toronto has better healthcare services? Okay, I like this. Health is free across Canada, but you may find that Toronto healthcare is more strained due to more people in that area in comparison to other areas. Health is free across Canada. That's interesting. But you may find that Toronto healthcare is more strained due to more people in the area. So, okay, Toronto is well populated, and because that puts a lot of demand on the available resources. Thank you for the eighth like. Let's know. Let's know who is joining in. I know it's morning, early morning in Nigeria and other countries in this time zone. We have been here for close to 2 hours now, and we are glad to have you join in. Myself and Toya, we've been chatting and having um, serious, engaging health, business, content creation chats. It's really been interesting. Okay, so health is free across Canada. Hope you can see that. Everyone joining in. Health is free across Canada. Do you want to go to Canada? But you may find that Toronto healthcare is more strained due to more people in that area in comparison to other areas. Wow, so Toronto is so populated. Okay, so let's see what Toya is saying about health and doctors. Toya says, my personal experience is some doctors are not that thorough. Okay. When you say not thorough, do you think it's related to the pressure, the work, or this is something related to personality? Um, do you think it's related to the individual or more to the system? You know, do you think the population is a factor? Like how many doctors, I mean, one doctor to how many patients? What's the ratio like? Yeah. Even though I say people do not really have excuse for non-performance or doing the needful, especially when it comes to services. You know, the passion for what you do must be there, and must be willing to give your best to anyone that has the opportunity to see you. So that's my belief as as a medical doctor. And Toya says, my personal experience is doctors are not that thorough. No, it's important to be thorough. I mean, it will just like you're giving a feedback now. If you have met or you have been meeting doctors who are thorough, then you will definitely be sharing that. And thoroughness helps a lot when it comes to prevention, when it comes to management of a patient or health matters generally. So sorry about your experience. Now, Toya says, I find doctors in Jamaica to be more thorough. However, Jamaica is a third world country, so it lacks equipment and resources. That's interesting. different strokes for different folks. Now, opportunities are not really there for Jamaicans, doctors, limited by available resources. But I hope they are actually being well paid. If they are working with minimum resources and they are still performing, and they should be encouraged, right? And so, what's the government doing to increase um, resources for better healthcare services? So, I give it to the doctors in Jamaica. So, well done and keep it up. So, healthcare funding for healthcare is another thing entirely that we should be talking about. And the more people are committed, whether at public level, government, whether at the private level, talking about non-governmental organizations, private sector um, commitment, will go a long way to help in elevating elevating the experiences of uh, the people in that community. So Toya says it could be a mixture of personality, culture, and processes or protocols. Yes, those are different factors that may influence the effectiveness of any doctor or even health professional. So, have you ever expressed this lack of thoroughness that you observed in doctors? Have you, at any time, given a feedback to maybe the doctor directly or the employer? You know, in what way have you tried to handle this lack of thoroughness? Has it cost you anything? Welcome if you are just joining us. It's a very beautiful morning from here. Let's know where you're watching from. And remember to double tap on your screen to like the live. Where are you watching from? It's a beautiful morning from this side. And in a few minutes, so in less than 10 minutes, say 5 minutes, we'll be closing on this live. I really appreciate your coming. Thank you for engaging. I mean, special thanks to Toya for really, really participating on this live, and then for everyone who has been here, and then for those who are just joining in. I mean, I still appreciate you. Okay, Toya says that's not really an option. It's better to just insist and stand your ground or get a second opinion. Hmm, that's good. So well, you must definitely talk about knowing your rights and doing what is good or helpful for your health. Okay, that's important. So if we can get a tent like to be good, if not, we are good to go. Mhm. So watch out for upcoming videos and another live session coming up soon. Thank you for staying tuned. Thank you for watching. Remember to check recent videos and let me know what you think. I actually did a video on the top 15 countries or places where people get to live longer. I mean, healthy and longer. So watch that video and let me know what you think about their lifestyle. I mean, I shared some of the things that you can also get doing to enjoy life that that way. So let me read your chat. Okay. Toya says, while the patient is not a doctor, a patient knows what they are feeling or experiencing. So true, so true, so true. I also want to share with you. Sometimes I have some doctors that um, are a bit sensitive. Um, they are usually wondering why a patient is coming to see them, but already has um, a diagnosis, and they're trying to pass their opinion to others. I mean, especially to their doctor, instead of coming in there to learn and to be helped. Okay, so but doctors are patients. Everyone need to be patient and get doing the things that we need to do. So the patient knows what they are feeling or expecting. So true. While the patient is not a doctor, a patient knows what they are feeling or experiencing. Yes. So it's important for a doctor to actually allow his or her patient to express himself or herself. That's important for even the management, in fact, the diagnosis and then the management. So, but if you don't allow enough feedback, enough feedback, uh, then you may be missing out on the proper management of your patients. Talking to the doctor now. So patient needs to have an open mind and listen also. Yes, very important. You know, it has to be that understanding. There was a time I did a video on what your doctor expects from you in the consulting room and what you should be doing when you get to your doctor's consulting room. Some people tend to shrink, they are withdrawn, even though they are there to get help, but somehow they are not expressive enough for them to get the required results that they want. All right, so this is very important. So thank you once again. I'm going to see you again soon. Uh, any parting comments, Toya? Okay, bedtime. So what time is it there now, Toya? What time is it? What time is it? I should also catch some rest before I get into the activities of the day. Please let me know what time it is there. Oh, 10:23 p.m. Wow. Okay. So somewhere in the US now, it should be around 11 p.m. So thank you so much for joining in. Please have a pleasant night rest. It was Good. It was nice having you here. Thank you so much. Have a blessed week, Toya. And everyone, bye for now. Bye.